All right, welcome, Dr. Truong, to True Hope Cast. Thank you so much for being with us, being with me today. How are you? What is going well?
Oh, I'm fine, Simon. Thank you for having me on the show, and I'm looking forward to our interesting conversation today.
Splendid. Well, why don't you just give us a little introduction about who you are and what it is that you do?
Right. So I'm a functional medicine doctor specializing in intimate health, and I'm located in Fredericksburg, Virginia, which is right an hour south of Washington, D.C. And I've been in medical practice for 22 years. And have started out doing pain management, and then I realized that I was not helping my patient, just giving them medication, doing cortisone injection, and I started doing acupuncture, and then I started doing hormone replacement therapy and progressed to doing stem cell therapy, and then now concentrating more on sexual health because to tell you honestly, I was more interested in it because my husband was having some issues, and we were in our late 40s at that time. And I dive into it, became really nerd, just kind of find out everything I needed to do on it, and realized that I can really help men and women with reversing sexual health at an early stage, so that way they don't feel that everybody thinks that sexual health declined over time, and our approach is that there is a way to reverse and treat decline in sexual function with lifestyle factors, hormone replacement therapy, and sometimes with stem cell therapy.
Interesting. There's a lot of stuff there,
Yeah.
and it's very interesting that we kind of a lot of people have the belief that as we age, many things decline, not just our sexual health, but our cognitive ability, our physical ability, even our emotional capacity. So I wonder if you could just talk to me a little bit about like anti-aging and aging in general. Like maybe what are like the misunderstandings about aging that we have kind of as a culture?
Right. Wow, that's a big question, but I'll hit on the main point is that um right now, currently with the technology we have in medicine, especially in the US, that we can really probably look at lifespan of look about 120 years. The average age for a woman in the US, the lifespan is 80 years old, and for a man is 79 years old. But if we know that now and say, hey, you know what, we can live up to 120. What do we need to do now? We need to do work with now when you're like 40, 30 to live up to 120. You don't start doing that when you're 70 and try to live up
Mhm.
to 120. And our body is made of organic material. This is where I'm going to focus on with the anti-aging is that our body is organic, meaning that it can handle food that is organic. So, this is not, what your body can handle. It's not like popcorn. You want to eat more of, organic food, meaning food and any food that come from the ground up, the Mother Earth gave you. Fruits, vegetables, anything that is the earth that the Mother Earth grows for you, and the animal that is there for you. That means that you don't want to eat anything in a package or in a box or in a bottle. You want to eat things that are fresh, that are grown naturally, because our body can process that better. If, for instance, if you eat like a candy bar, well, that's not made by Mother Earth. That's made, in the factory, put all that in a candy bar. And when you eat it, your body the liver have to work extra extra work to digest that and to process it so that way your body can recognize the form. It's the same thing. Same thing, like if you eat food that is high in fat content or in saturated fat, or if you eat more of simple carb, like a hamburger with potato chips, and then drink a Coke. Mother Nature doesn't make a Coke. Mother Nature doesn't grow a potato chip. And yeah, Mother Nature do have the beef, but not like the beef that you get in a hamburger, and even bread. Is not what Mother Nature grows for you. But what I'm trying to get is when you eat that, your body have to work extra, especially the liver, the kidney, to process it into a form that your cells in your body can process. And what it does is that when you do that, it put extra strain on the organ. When you put extra strain on the organ, it become decompensated, and over time it can cause inflammation. What inflammation mean in your body is swelling, a not balance, and it affect your hormone level, and then affect the electrolyte, the minerals in your body. That sets an inflammatory stage. So when your body is in a high inflammatory state, it ages quicker. So to really focus on anti-aging, you should start it like in your 20s and 30s, and eat clean. Eat clean and eat what I just mentioned, and also exercise. Exercise is important, not just for looking good, but when you exercise, you have increased blood flow. When you have increased blood flow, your heart start pumping. It pumps it up to your brain. Your brain vessels start, opening up. You get more oxygen in the brain. All the organs start to have a lot of blood flow to it. So when you have more increase in blood flow to the organ and to the brain, you're essentially kind of priming it. You're exercising it as well. And getting more blood flow is good for every organ in the body as well. Now, your brain uses 40% of all your calorie intake, as well as the cardiac output. So when you exercise more, you have better brain health, you have better organ health. And how much exercise? Well, an hour, 3 to 4 times a week. And it could involve just walking, or doesn't have to be running a marathon every time. So diet, exercise, and sleep. Sleep is important because when you sleep, at least 7 hours, when you sleep, your body heals. So our body heals from 10 p.m. to 6 a.m. So physical healing starts at 10 p.m. to 2 a.m. What do I mean by physical healing? Like a healing of your heart, your liver, your kidney, your brain. Physical healing is from 10 p.m. to 2 a.m. 2 a.m. to 6 a.m. is mental healing, brain healing, everything that goes on in here. Is from 2 to 6 a.m. So sleep at least 7 to 8 hours a night, because that's when your body heals. When you don't sleep, and you sleep like maybe 5 hours, you're not having complete healing of your body. So our body can actually rejuvenate itself if you let it. If you feed it the right food, if you rest appropriately, it can really get rid of the dead cells and then rejuvenate itself. A lot of times we don't spend that time in allowing our body to rejuvenate. And the other factors I cover: diet, exercise, and sleep. The other factor is really decreasing stress and have that mind body balance. Meaning have time to yourself and have time to de-stress, so that way you're not going all the time. Because when you're always on the go, always working, not having time to rest, what happens is that you increase your heart rate. Your resting heart rate rises above normal. Like, for instance, I saw several patients today. They're business owners, they're always on the go. Their resting heart rate is at 80,
Hmm.
in the 80s. That's not good.
No.
Right? Yeah, that's not good. Your resting heart rate should be in the 50, 60. The resting heart rate is in the 80. So what does that mean? That does that translate to? Your heart's working a little bit harder than it should. So you're straining your organ, you're straining the blood vessels as well. So what does that lead to? Lead to, like heart attacks and stroke and high blood pressure. So that is something you need to stay attuned to, is what your resting heart rate is. Try to kind of be aware of your resting heart rate, because when your resting heart rate is high, you also begin to produce in your body called acetylcholine. You start stimulating a nervous system in your body called the sympathetic nervous system. And that nervous system is usually only activated when you're in stress or when you're running away from danger. So we are programmed to activate that system to run away from danger and in times of stress. But we don't need to do that, just sitting in front of the computer. So when you're continuously stressing your body out like that, the organs start to wear out. So those are the main thing that the biohack, that you really need, because if you eat appropriately, you're gonna have enough nutrition in your body. And if you exercise and eat, you don't have to worry about obesity, right? You don't have to worry about being overweight, right?
Yeah,
And then
absolutely.
if you eat well and you exercise, what happened? Your sleep gets better also. You sleep better and you're more tired. I know that the days that I exercise, I sleep like a baby. But if I don't exercise regularly, I don't sleep well. Um, and then just taking time out to de-stress, to enjoy nature, just going out, just enjoying nature and walking and spending time with your family and really paying attention to what your body is doing at rest. And it's hard to do with living in our society nowadays with
Yeah.
cell phone and computers and everything else going again. But those are the simple things that you can start right now to
Yeah.
this moment to
Yeah,
start
just
biohacking.
exactly. Just as you say that, I mean, you're talking about like I think everyone kind of would understand that if they wanted to be healthier and start feeling better and potentially slowing down their aging process, it would be taking care of their nutrition, taking care of their exercise, sleeping better, and reducing their stress. But yeah, we live in a culture where we have awful food around us. Even the food that's grown organically in good, in very quite depleted soil now, just isn't what it was. We don't exercise as much. We're sat. We sleep. We go sit in our car. We go sit in our desk. Like we're never really up and around anymore. And yeah, again, like sleep, we've got screens, we've got Netflix, we've got unlimited shows to disrupt all of that, and then we just have this society that just kind of like um, celebrates stress and being busy and having all these things to do, and we don't have the appropriate time or skill set to even like begin to help us de-stress like we would have done like many thousands of years ago. We would have had things like acupuncture and meditation and all these other things that we would have like naturally been able to put into our daily lives to help reduce that load. So it's interesting that you're talking about having enough like organic material coming in to for your body to do its incredible amazing thing, but we very rarely have a surplus of that nutrition available for that extra like building, because we're always trying to tackle the toxic load of poor food, not sleeping enough, not exercising enough, and being stressed out. Body is constantly having to use all of its resources to deal with all of those things that we kind of put on the body itself. Like it's kind of we've got a lot of self responsibility in regards to those things. So very, very interesting. There was a big question. I really appreciate that answer there, because you can take that down many different avenues, but that was perfect. Are there any like key things? I mean, obviously we know about like good nutrition, exercise, sleep, and de-stressing. Are there any other things that science shows us is really effective against anti-aging, like
Oh,
things that we
yes,
can
right.
take or
Mhm.
therapies?
Yeah, so, and I wanted to add on there also, not smoking is not a good thing. So smoking will accelerate aging, because smoking will decrease the blood flow to your organ, and not to mention, other causes. And then alcohol, like I said, alcohol is not organic. The earth doesn't grow you alcohol. You have to make alcohol. So alcohol itself is toxic to the liver, and I keep stressing the liver because the liver is the filter of your body, and you can overwork it and it become decompensated. That's what produces a condition called fatty liver first, and then cirrhosis, which is scarring of the liver. So alcohol and smoking are the big factors of that, and of course, taking anti-inflammatory supplements, will also help with the anti-aging process as well. Now, I want to add that on there, that you have to kind of do the first few things that I mentioned first with the diet and exercise. But if you eat a poor diet, you don't exercise, you take supplement, it's going to be a wash. It's not gonna work, and if you eat appropriately and you exercise, you have no need to take medication because, let's say you have high blood pressure, you gotta take medication. Well, that medication is made in the lab. Let me give you into perspective, like, a medication that's made in the lab is synthetic. Your body do not recognize that medication. So what's gonna happen when you take that pill for that high blood pressure? It's going to go to your stomach dissolve it, and then it goes to your liver. Your liver has to say, oh, okay, this is something foreign. I had to break it up into little pieces that the body can recognize. So it has to chop it up and it has to mince it. And then it goes to the bloodstream, so that way your cells in your body can recognize it and go, oh, okay, this is what I need to do. I need to open up the blood vessel more, so that way decrease decrease the blood pressure. So what I'm trying to get at is that when you're taking a medication for a condition, you're taxing your organ out, like your kidneys and your liver out more, because it has to process it into a form that the body can recognize. You see what I'm saying? So how do you combat that? Well, you can, control the blood pressure by, the diet and the exercise and decreasing the stress. Because the more medication you take, the more side effects. That's one of the reasons why the more you get side effects when you take a medication is synthetic. So when the liver is trying to mince it and chop it up into little pieces, it's gonna make it like it's gonna go into like a different pathway in your body. It's gonna cause these side effects that you have. So that's why we have side effects when we take medication, because the liver can't process all of it, and some of the medication is gonna go into some pathway that
Yeah.
causes an unintended reaction.
It's interesting that we have, with side effects, we've kind of just like accepted that they're okay and that it's like a normal thing that you might get when some of the lists on some of the drugs are absurdly large, like the font that they use on these pamphlets. We're talking about hundreds of different potential side effects, but we I don't know, we have this very interesting risk analysis with that type of thing, when there are certainly other options on the table, but like we have a culture that wants to take one pill for something, and when you hit 50 you should be taking this drug, and it's interesting how we've normalized these side effects and not recognized that they are unbelievably foreign to the body, unbelievably toxic to the body, and the fact that you have side effects is just a prime advert that they don't belong in your body whatsoever. And like if people take these things for decades, and the long-term damage of something like that is just quite remarkable. And it's interesting how we have come to a position where we've normalized this risk of taking a particular drug when you could take your health into your own hands and sort your sleep out, sort your nutrition out, sort your exercise out, de-stress yourself somewhat. It's interesting that we don't want to do the work.
Well, I think you put it well like that, because I'll give you an example. My office is near a hospital, and when I go to the cafeteria in the hospital, sometimes they don't even have a salad there. Most of the food that's available is in sandwiches or spaghetti or things like. I can't even find anything that is like a salad or fresh fruit at times, and it's like it's not available because it's so easy for the manufacturer just to make a chips or a candy bar for you to eat as a meal replacement. It's also
Yeah.
convenient because you don't have the time to sit down and eat. I take care a lot of patients that are 100. Well, I have one right now that's 108. She's on no medication whatsoever.
Wow.
No medication. Her blood pressure is pristine, no high cholesterol. And I asked her, "What's the secret? What's your secret?" And she said, "Well, I watch what I eat." This is how she talks. "I watch what I eat. I walk 3 miles a day since I was young. Rain, shine, or snow, I walk 3 miles a day, and I don't take things seriously. I don't take life seriously. I take it in stride, and I enjoy living life every day." You
Yeah,
know?
that's wonderful, and what a remarkable testament to taking care of yourself and taking responsibility for your own health at such an early age. Like I'm 38, And one of my like forecasting goals is to be the healthiest I've ever been in my life in a couple of years when I'm 40. And I'm also thinking about my like marginal decade. I'm thinking about my last 10 years and how I want that to look, and what I can do now at 40 years old to make sure I achieve those goals, and set these kind of like benchmarks of like where I should be at 40 and 50 for some of the metrics within the body. But you don't have a lot of people that kind of think like that. I think there's, with the like biohacking stuff, and there's like some really amazing researchers, scientists, doctors like doing cool podcasts about that type of thing, like backcasting. So it's a very interesting idea that you would, in your 30s and 40s, start thinking about your 90s and your hundreds. And I think, just a side note, your patient who's 108 should start a podcast called 108 Plus, and I'd listen to it every week.
And that's not a bad idea. I should talk to her about it. And in fact, if you look at population in Japan, which has the highest, centurion, they're having people that are living up to 120, 125, and we're talking about like thousands.
Yeah,
You look at their diet, and you look at their diet, and you just look at their body. They're pretty slim. I mean, they're pretty average size, and they move around quite well. And why is that? Because the secret is what I just said. That is really the secret to longevity. It's what I just summarized what my 108-year-old patient
hmm,
said right there. So you watch what you eat, but she eats stuff too, but in moderation, and walk. It doesn't cost you to. You don't have to belong to a gym to walk outside 3 miles a
sure,
day,
yeah,
and watching what she eats, and just take things in stride. Sometimes like I you mentioned earlier, people have to buy these apps to de-stress, or buy these fancy things to monitor everything. Where just what my patient said, just take things in stride, enjoy life, and appreciate what you have. And
gratitude, yeah,
gratitude is the big word. Gratitude and enjoying life every day. And sometimes we overcomplicate things.
yeah.
We just like mean that we need to have like 10 app. I mean, I have a patient that has, I don't know, a monitor on the hand, a monitor on the finger, and and a monitor on their arm.
I'd be stressed out just to have to pay for all those things and sync all those things, and
Yeah,
update all those things. Yeah,
yeah,
it's interesting because like the people like you, your patient you're talking about, the 108-year-old woman, her normal is other people's. Like, so she would do like 80 to 90%. She'll do like really, really great things for her body. And then like she might indulge and have a 10%,
yeah.
which, in
Uh-huh.
moderation, which she probably deserves. But everybody else's 90% is junk and trash and not taking care of yourself. Right. And that's the normal thing. And I'm sure if you were to take, 100 average Japanese individuals and 100 North Americans, and you line them all up together, I think you'd see a massive, massive difference just by looking at individuals. You wouldn't even have to take blood work and do measurements, anything like that. You could just like see there's a certain way, a certain culture that these individuals have been brought up in that is more connected to taking care of themselves and taking care of probably the earth and the food, where their food comes from. But we haven't quite figured that out in North America. I mean, America and Canada, it's still quite a new country, and we're still trying to figure out our cultures, but it's not as obviously as ancient as other countries. But yeah, it's interesting. But I want to switch and talk about, because you work a lot with biological cellular medicine.
Mm-hmm.
Can you tell me what that is? And yeah, please tell me
Right.
what that is.
Right. So, and I alluded that to earlier, is that our body has the ability to heal ourselves. And I'll give you an example is that when you cut yourself, there's a cut, and the blood that bleeds into the area. And then a few days later, that cut heals, right? You have a scar. Do we have the ability to heal ourselves? We just don't harness that, those cells that actually heal ourselves. So in your body, in your blood, there are cells that are called platelets, which comprises about 5% of your blood. And these platelets are the ones that are responsible to initiate the healing response in the body. They're in the blood, and they go into the site of the injury, and they stimulate all the other cells in your body to come to the area, like a troop, come to the area and start cleaning the injured area and start laying down cells for healing. And you also have those cells too in the bone marrow, which is in the hollow of your bone. And you also have healing cells in your fat. The fat that's mainly in the love handles, those fat cells can actually heal as well. So how we do in the anti-aging world is that we bring the good stuff to an injured area. For instance, let's say you have a rotator cuff injury. You injure your shoulder, you can't lift it up. It's because the muscle and the tendon is a little tear. You have a little tear there, and that's why it's make it weaker, and you can't raise your arm up. Well, you don't do anything, that tear is going to get worse. Imagine a tear is kind of like you have a rope, and you have it's partially torn, it's not connected together, but still connected. Well, what I do is that I take your blood out from your vein, and we put in a centrifuge, and we separate the blood into different layers, and then we just take out the platelets in your blood, and then inject that into the tear of the rotator cuff or the shoulder muscle. And what the platelet does is that it goes in there, it creates like a little sealant, and it start telling the cells in the body, "Hey, come over here, come over here. This area, I need help in decreasing inflammation in the area, and I need help in laying new cells to start healing the area." Um, so that's what the platelets do. So I just bring the good stuff from your body to that area. And then you asking me, well, how come we don't do that naturally, right? How come you injure your shoulder? How come we have blood there? How come it doesn't go? That's a good question, because when you injure an area or an area of pain, that area is surrounded by fluid, by swelling. So it doesn't have a lot of blood flow into it at all. So you don't have a blood flow into it. So as you do nothing, that area it deteriorate and gets weakened. So that's why we have to bring the good stuff in your blood to that injured area by doing it and by doing injection. Does that make sense? Because your
Totally.
body protects itself
Yeah.
by the swelling and but then on the other hand, it's preventing healing. Like for example, your knee doesn't have direct blood supply. It doesn't have direct blood supply in the knee. It gets the blood supply from the neighboring muscles to absorb into the knee. So if you play soccer and you twisted your knee, and you may have injured your ACL or your meniscus. It doesn't have the ability to heal itself. So I would have to bring the platelets from your blood, or the stem cell that's in the bone marrow or the fat, into the area to stimulate the healing. So we can facilitate and accelerate the healing of an area by using your own body tissue to initiate the process.
Is that the platelet like rich plasma
Yes.
therapy?
Yep. Yep. That's a
Very,
platelet-rich plasma.
very,
Yep.
very cool. Is that expensive, or is that covered by anywhere? Is that
Um,
something you
no, it's not covered by insurance, because insurance don't think that it is still experimental, and it's actually not. The American Orthopedic Society recommended use that for elbow as well as for mild arthritis. But insurance company, it has not approved for that, so it is a non insurance cover service, and you're looking at around about $1,000 to $2,000 for a treatment with the platelet rich plasma, and then a little more if you had to use the stem cell from the bone marrow or from the fat.
Very cool. That's amazing. That's even an option. It makes, that's a prime example of how, science and medicine can really, really support and help a lot of people where it wouldn't have been able to do so before. So that's amazing that you're able to do that. I'd love to switch and talk about sexual health. And in your opinion, in your experience, is it in decline do we have an issue with, like, do we have a big issue with sexual health? Because it's something I know that you deal with a lot.
Right, right. Well, the word I want to yell out is that sexual health is very Sexual dysfunction is very very common. According to a study that was done in 1999 in the U.S., at that time there were 30 million men living with ED. And we're talking about 1999. We're talking about 23 years ago. So you would just suspect that it's more now, and probably more than 30 million men living with ED. And I would probably equate that to just similarly, with women with sexual dysfunction as well. Now, where there's a myth that say, well, I'm getting older, of course I'm not going to be interested in having, intimate relation because I'm just getting older. Well, that's the myth, actually. That's a myth because as you get older, as we talked to before, as you get older, you're more prone to having high blood pressure, or being overweight, or having high cholesterol. So all of those factors, actually, like obesity, hypertension, and high cholesterol, or diabetes, predispose you to have sexual dysfunction, because when you have those conditions, it lower your hormones level, but it also decreases blood flow to the sexual organ for men and for women. And that's why you see that more in patients that are older rather than in younger population. But I mean, today I saw a guy that's 35 years old and he has ED. It's because he smokes, he drinks alcohol, he doesn't sleep, he's high stress, and he's obese. Yeah. So you can see it younger too if you don't take care of yourself, and if you have these other lifestyle factors that are detrimental to hormonal health. And I also want to mention smoking and alcohol is a big contributor as well too. So um if you eat well and exercise and have good lifestyle factor, you will continue to have sexual activity to the day you die. I mean, how often we're hearing more and more of that now, and people in their 70s or 80s are still having sexual relations as much as they were when they were younger. It's because they start to realize that the myth that it gets into your head, hey, when you're past 50, you're old and you shouldn't be enjoying that anymore. And then we also live in a culture that is taboo to talk about it, or is taboo to, as you get older, to even think about that as well, which I find interesting, Simon. And that sexual relations, it's how we came to the earth, it's how we came to be born anyway, right? But it's shameful to talk about it, and it's an off topic. In fact, you can't even advertise the word sex. It's like it's all shoved under the carpets in the closet, but everybody does it. And it's something that is for enjoyment as well. And that your sexual health, or your ability to continue to enjoy sexual activity, correlate with general health, and it's in parallel. So if you continue to have good sexual relation intimacy, that means that you're healthy. Your general health is doing well. But if your sexual health decline, let's say for a man, for instance, if he start having erectile dysfunction, it's really a harbinger, a red light, and say, hey, you know what? Maybe something's going on in your general health. You need to kind of look at right now to see if something is off. Do something about it before you start taking that little blue pill just to help you perform a little bit better. Like you said, we live in a society that focus on, taking a medication for this, medication for that. Today, I saw a patient that taking a medication to sleep, then is taking another medication to help him to be awake, like an ADD medication, and taking another medication to help him relax. So he's on, an alprazolam, and he's on another medication to help him with depression, and then he's on a sleeper and a downer. Yeah.
Wow.
So, yeah, you
Yeah.
wonder what your
Serious.
body gets confused or what go working at, what time. So the big point is that you can is that sexual health can continue to the day you die, and it doesn't have to decline with age. And that when a man or woman feel that, hey, their libido's a little off, or they're not having, the responses they used to have when they were in their 20s, take a look back and say, okay, am I, what their are they smoking? What their alcohol intake? I'm not saying don't drink alcohol, but in a week you should probably drink about less than 7 drinks a week. Um, and sleep, are you sleeping as well? How are you doing on your diet and your exercise and stress? Those are the big things that contribute to decline in sexual health. But we don't look at that, do we? When we say, oh,
No.
if a man thinks that he has ED, first thing he's going to do, he's going to go on Google and try to, get, and start, taking a Viagra when I equate that to almost like taking an opioid pain medication for back pain or neck pain. You're just band-aiding the problem. You're not looking at the source of the problem, because they don't realize that sexual health, a decline in sexual health, parallel a decline in your general health. It just
Yeah.
hasn't appeared yet. It appears about a decade later.
Interesting. Yeah, I mean, it makes total sense. I mean, we've spoken about nutrition and exercise and sleep and all these aspects that the body needs to be taken care of in order to thrive. Um, can you just explain to us a little bit more of like maybe the biochemistry around? Let's just say somebody, you know, eats pretty decent, moves their body well, sleeps okay, but they're very very stressed out individuals. So a lot of their issues is in their mind, right? They're anxious, depressed, whatever that might be, and how those literal thoughts can manifest into issues downstairs and how that actually works.
Well, that's a great question. This is my favorite subject to talk about, because the largest sexual organ is the brain, not below the belt. Okay. So when we think about, sexual activity, we think about, the sexual organ. No, the largest sexual organ that needs to initiate the sexual response is your brain. Your brain. Everything starts up here for men and women. How so? How do you get aroused? How do you get desire? It's what you see, what you smell, what you taste, what you touch, and what you hear. Your senses, your five senses, feed into your brain, into the part that's right behind, like your eyeball. Then feed into your brain. Then you start getting aroused. You start getting increased desire. You start feeling better, and then your emotion, you start to feel like really good, and then your hormones start to release in the glands in your brain that sends messages down to the nerve in your spinal cord, that sends messages down to your heart. Your heart starts beating, and you have that response, a response of arousal. And then your blood vessels starts relaxing, start to open up. You have an increase in blood flow, and the blood flow flows to the sexual organ. The sexual organ, the muscle has to be relaxed in order for it to receive the blood flow. So the main thing about having a response in the sexual organ is that it has to accommodate increased blood flow. So for a man, below the belt organ, you have to have increased blood flow. And same thing for a woman. How does the muscle and the sexual organ accommodate increased blood flow? That organ has to be, the muscle itself has to be relaxed. So a lot of men don't realize that in order for them to have, sexual relation and have, intimacy, their muscle down there have to be relaxed. And how do you get it to relax? You have to be in a good emotional state up here to be relaxed, not anxious, not depressed, and not stressed. Because when you're anxious and depressed and stressed, what happens? You send messages to the nerve in the spinal cord here to constrict the muscle down there. That's why you're
Mm.
not gonna have you're not gonna have the sexual organ's not gonna respond. You see what I'm
Yeah,
saying? So,
absolutely. Yeah.
yeah, yeah. So it all go into the nerve. It all starts here in the brain, because the brain got to send messages to everything or everything else from here to below the belt, for in order for it to work, and that you have to be in a relaxed state in order for you to be aroused, in order for you to be functioning in tip-top shape form. So a lot of I see a lot of men, and a lot of men just say, "Well, only that down there is the only thing that needs to work." I go, "No, it's controlled by this guy up here. This guy up here, this guy up here is not in the right space. Nothing's gonna work below the belt.
Yeah,
Nothing." Yeah,
I recall my wife and I were looking to have our second child,
yeah.
and there was a lot of stress around it in regards to scheduling and making time for it. And it was honestly, for me personally, it was a really, really stressful experience, like having the schedule and the time around it, and just nothing was happening. Nothing was going to happen in those times. But then, like, once you kind of let go of that idea of like trying to make it happen, it happens, right? So it's yeah, I've got my own personal testament to that, and it makes total sense when you recognize the mind and the body, and the mind obviously has to be in a particular state in order to produce the biochemistry to make everything else work. So it makes a whole lot of sense. And I know we're coming up. I know you've got another appointment coming up, so I'll ask you kind of one more quick question. But and I think I know the answer to this, but like, how bad is like taking a drug like Viagra on like a long-term basis? Because I presume most people who get prescribed it are in a position because they have erectile dysfunction, because they have issues, and it's most likely because they are maybe overweight, overstressed, undernourished, and all these other things that we're talking about. So like, their body's already in this like state of emergency, and then we're throwing this drug at something. Like, how kind of bad is that, like, that combination?
Very bad. And I hope that the listener hears this loud and clear. Very bad. Because I equate Viagra, it's like taking opioid medication. It's the black hole. It's going to give you short-term relief, but in the long term, you are in the black hole. All right. You're going to end up going nowhere, because Viagra, remember what did I say? The sexual response, in order for men to get an erection, it starts here in the brain. Viagra totally bypasses the brain, bypasses your heart, bypasses the emotion, and it goes straight down to the sexual organ. And what it does is that it relaxes the blood vessel in order for in order to have increasing blood flow. Okay, it relaxes the blood vessel, but it bypasses everything above the belt. So what happened? So the man get the result, but what happened is that your body is sensing, oh, in order for me to get an erection, I need that little blue pill now to start working. So then you start, I call it hijacking your natural response to having an erection. So when you start taking Viagra, you might as well you might as well say, "Here, Viagra, take away my natural response to have an erection." And it's like, you're essentially saying, I can't have an erection unless I need that blue pill to assist me with opening up the blood flow, because you're hijacking it. You're skipping step 1 to 5 and go straight to step 6 to increasing the blood flow, down there. So it's very bad. Plus, Viagra increases your blood pressure when you take it. So in a man that may have heart issues or high blood pressure, your blood pressure goes up higher, and you don't know it. You don't know it when that time that you take it, that you may end up having a stroke or a heart attack. And then also you also have, there's a lot of side effects with Viagra, such as flushing, the face become red, nasal congestion, yeah, vision changes, and headaches. Now, well, why do you have headaches? Because the blood pressure goes up. That's why you start having headache. But a lot of men go, well, I can tolerate the headache because I can perform. Well, not for long, guys. Not for long. 'Cause one of this day, that headache's going to become worse. So if you start to have side effects Viagra, stop. Stop right away, because your body is telling you, hey, I can't handle this,
Yeah.
so stop it. And if you're starting to take Viagra, you don't see any side effects. That doesn't mean that you're not curing anything. All right, you're actually creating more problem than you start up with. And my suggestion is, stop taking it, take 2 step backward, and evaluate what are you doing with your lifestyle. What are you eating? Are you exercising? You sleeping? Take 3 step backward, because I would tell you, with the patient I treat, when I tell them to do that and they just eat better, they exercise better, and they sleep better, you know what they tell me? They go, "Oh my God, without even any treatment, it's they got, I'm now, things are starting to work now, doctor. My wife is starting to see that things are starting to work now without any other intervention, without Viagra or Cialis.
That's great.
Now, Cialis now have a 30-hour half life, meaning that it's active for like 30 hours. So when you're taking Cialis, you should also pay attention to the blood pressure as well too. So we live in a society that, hey, let's take a pill for this condition, when it's really not curing your problem at all.
Yeah, I mean, we obviously have these very deliberate, ancient pathways from our brain all the way down through our body. And if we're to put like a big stop sign in front of one of those, we're inevitably going to see huge problems with that, like with downregulation of certain hormones. And as you say, like our body learns that this blue pill can take care of that process instead. So the brain's just going to be, it's not going to just waste its time trying to do a job that it doesn't need to do. It's very, very interesting in how that works. And obviously, I think with females, with their like hormonal cascade, it's significantly more complicated. But yeah, we can get in that to another time, because I know that you're very time sensitive right now. So if you just finish up and just let people know how they can get a hold of you and connect with you.
Right. Well, thank you for having me on today. It's been a pleasure talking with you and discussing this, and I'll be more than glad to come back for continuing talk. So, how they can get a hold of me is that my website at truongrehab.com, TruongRehab.com, and I do have a gift for your listeners, and the gift is actually on my website. If they go down there and download the free ebook, if they go download the free ebook, it talks about the 5 common mistakes men with ED make, and try to avoid them, and don't make these mistakes, because it's going to make you worse. And also, they can get a hold of me on Instagram at Dr. Ann, DRANNE underscore official, OFFICIAL. I'm on Instagram, and on my Instagram profile, they can also get the free gift as well too. That is the ebook about what not to do when you have sexual dysfunction.
Beautiful. Well, I'll make sure all that information is in our show notes so our audience can get a hold of that information. And I appreciate the free ebook. That's wonderful information. Thank you so much. But yeah, thank you so much for talking with me today. I found it very, very interesting.
Well, thank you a lot, Simon. Take care. Have a great day.
Perfect. Thank you. Well, this is True Hope Podcast, the official podcast of True Hope Canada. We'll see you next week.